So Hillary Clinton once said, "Human rights are women's rights, and women's rights are human rights." Today I'm going to be talking about Planned Parenthood and why it's essential to the American healthcare system. I'm going to be covering what it is, who uses it, why it's controversial, and why it's essential. First, for all of those who don't know, what is Planned Parenthood? Planned Parenthood was created in 1916 to provide Americans with reproductive health care, and it was created by President Margaret Sanger. There are over 600 clinics nationally, and annually more than 700 million men and women utilize Planned Parenthood. Their missions and goals, as stated on the Planned Parenthood website, are to provide complementary and reproductive health care services, to advocate for rights to those services, to provide educational programs to enhance understanding of human sexuality, and to promote research and advancement of technology of reproductive health care. Additionally, their goals include providing expert health care to their patients, informing and educating the community on human sexuality, leading the reproductive health and rights movement, and advocating global health. So who uses Planned Parenthood? In America, 1 in 5 women in the U.S. has visited a Planned Parenthood center at least once in her life. Ages 20 years and older is 83% of patients. Patients are normally at incomes at or below the federal poverty level at 79%, and the amount of people who use Planned Parenthood services to prevent an unplanned pregnancy is 75%. Why it's controversial. So, despite what many believe, Planned Parenthood doesn't have a specific budget and line in the federal budget for it to receive funding. So basically, they are funded by Medicaid reimbursements and Title X funds. Title X funding provides Americans with basic, affordable birth control and reproductive health care. Defunding Planned Parenthood would cause a national health care disaster by preventing those who rely on Medicaid from receiving basic reproductive health care services that every American has a right to. Additionally, the most controversial issue is abortions. Debunking myths. Despite what many politicians may want you to believe, including President Trump, many citizens are misinformed on the amount of people who receive abortions from Planned Parenthood. This is a percentage breakdown. STD and STI testing and treatment, 42. Contraceptive, 34. Other services, 1%. Cancer screening and prevention is 9%. Other women's health services like pap smears and that kind of stuff is 11%, while abortion services are only 3%. Why it's essential. Low-income families and women of color are heavily impacted by Planned Parenthood. For thousands of low-income and impoverished American families, Planned Parenthood is their only source of health care. 79% of patients are people who come from below or at the poverty line. 22% of Planned Parenthood patients are Latina and 14% are African American women. These two groups of women are genetically much more likely to be evaluated or eventually be diagnosed with cervical cancer than white women. In conclusion, millions of men, women, and young adults turn to Planned Parenthood for basic reproductive health care needs such as STD screenings, STI screenings, treatments, and contraceptives. Despite your beliefs, there's a statistical evidence that Planned Parenthood does more than what the media claims it does. Not only does it provide health care to millions annually, but it helps prevent unwanted pregnancies and provides many low-income women with cancer screenings and prevention. This program is essential to American women and protects us and our rights to our bodies, whether that be contraceptives or pregnancies. When considering if we should defund Planned Parenthood, I ask you to consider this. During Supreme Court hearing in late 2018, Senator Kamala Harris from California asked Brett Kavanaugh regarding his want to defund Planned Parenthood services. She said, "Can you think of any law that gives the government the power to make decisions about the male body?"
Specifically just the male body? Because now I'm thinking about that. Do we? I don't think they're.
Wait, what?
Because a lot of laws apply to male and female bodies. Murder, for instance. So. Oh yeah.